Hi, everybody. Hello, Makale. Hello, Dosto. This is Dr. RP here. Yesterday, I met with you in a different topic, the Chinese pediatric infection. Today, I have got Dr. PP. She is an ophthalmologist.
Hi.
Today, I've got an interesting topic to discuss. Hello, Dr. PP.
Hello, everybody.
Yeah, hi. Before I jump into the conversation, this channel is called as IWSO, which is I Want Second Opinion. You know that. Anybody who has got any orthopedic or spine related issues, I'm an orthopedic surgeon and with a super specialty in spinal surgery. If you've got any major queries that you want to get a second opinion about, you can approach me. Or we have got all the experts in other medical specialties. For example, Dr. PP is also there. She's an ophthalmologist. If you've got any query, you are more than welcome to write to us at iwantsecondopinion@gmail.com and we will try and clear your query. Right. Okay. Dr. PP, sorry about my introduction and stuff like that. Now, we're going to discuss about an important aspect of ophthalmology, which is diabetes in ophthalmology. Can you throw us some light about how diabetes affects in the eye conditions, please?
So diabetes can basically affect almost all parts of the eye. So we have to reach the awareness that it can affect the eye, which, for example, can cause changes in of the vision during. But that depends on the control of diabetes. Levels fluctuate a lot during the day. It can just simple fluctuation in vision. Suddenly it will be blurry, suddenly out of focus. Suddenly your prescription, you might feel the glasses are not as good as it used to. It can reflect in that. It can give rise to cataract in the eye. That can happen with uncontrolled diabetes. It can give rise to what is called as diabetic retinopathy. This is the major things that can happen back of the eye because of diabetes. It can give rise to swelling at the back of the eye, which is called as diabetic maculopathy. It can give rise to double vision because when the circulation in the muscles which control the eye, if the circulation is affected, it can give rise to. It can affect the circulation in the nerve of the eye, where it can give rise to loss of blood supply to the eye and giving rise to permanent damage. So there are different aspects of the eye which can be affected because of diabetes and the lack of circulation secondary to it. So the bottom line is, yes, diabetes can affect the eye and we have to be aware of this, and the control of diabetes can prevent these changes. And that's what we are going to talk about.
Right. Okay. Now, for how long does it take for a patient who suffers from diabetes to have effects in the eye?
It depends on the type of diabetes. So in a nutshell, for the diabetes to cause micro blood vessel changes, the tiny blood vessels by the eye, for it to change, it could take up to 10 years. On an average, it depends on the control. But it depends on whether it is type 1 diabetes or type 2 diabetes. Say, for example, in type 1 diabetes, the baby could be diagnosed with diabetes in less than a year, in which case their diabetic changes can start happening from the age of 10 or 11, again, depending on control of the diabetes. But in a type 2 diabetes, we don't know when the pre-diabetic condition was, when they were developed a diabetes, because a diagnosis is made at some stage, and that is the acquired diabetes. So when that happens, what we generally say is we have to start looking for the diabetic changes from day one. So basic screening or basic eye examination should be done with the diagnosis of diabetes, and from then on, depending on at what stage they have in the eye, we can continue the monitoring of the eye changes.
Right. You mentioned about what are the changes that can happen in the eye because of the diabetes. If I'm not wrong, if I have to consolidate, you told that there might be change in the vision. Number two, you told that there can be cataract. You told that it can also lead on to diabetic retinopathy, which is the background. And you told that the nerve can be affected because of that as well. Now, in what way the patients will be manifesting the symptoms, or how will they come to know that will they come to know at all in the first case?
A few changes we may not know, but if they have symptoms like, say, for example, if the vision is fluctuating, like suddenly you're looking at the computer or the phone, and then you feel that the glasses which you were wearing in the morning is not doing well, the vision is changing now, it's not under focus. Or if you don't wear glasses, you feel I might have to go and get my glasses checked because the vision is fluctuating during the day. So what happens is, the basis behind this, lens in the eye, it imbibes the water. So depending on the sugar levels, the lens could be hydrated or it could be swollen. So based on that, your prescription can change. So it depends on the water content inside the lens, which is changing because of the sugar levels in the body. So an optimized control throughout the day can prevent this from happening. So this you will get to know when you see the optician. They can say that the prescription is changing fast, or when you regulate your sugar levels, when you monitor them, you will know that it's fluctuating a lot. Your doctor should be able to advise you on a better optimal control of sugar levels. The second symptom which can happen is when a cataract happens. Cataract can happen to all of us when we grow older, but a diabetes can bring the cataract a bit earlier on. So when an uncontrolled diabetes happens, it can affect the cataract, which can happen in a particular part of the lens. The way the patient will know about it, it could be unilateral, or it could be either affecting one eye or it could be affecting both eyes. So when that happens, a person will know that things are a bit misty and a bit foggy. So it depends on where exactly the cataract is. It might feel like your glasses have a scratch so that you're not able to focus on that. Or you might feel the whole vision is like seeing through a net curtain, or a bit foggier day and things like that. And the third thing, which is very, very vital for everybody to look out for when they have diabetes, if they notice a sudden onset of floaters. By floater, I mean they might feel that suddenly there is a cobweb in front of their vision, which they want to remove, or they might feel whenever they move the eye, a little spot or something like a spider web or a spider comes in front of it, which they want to catch, which they may not be able to catch, or it could be suddenly like an ink blot inside a pot of water. If you put an ink, it will just gradually. So it could be a vision like a smudged vision. So these things are called as floaters. This is important because it could indicate there is a small bleed in the eye, or there is some changes happening in the jelly of the eye, which needs to be looked at. So that is very important to be checked immediately if they notice a change like that. The fourth thing is it could give rise to, like, they may not be able to focus on tiny letters because it is appearing distorted. So it could feel like that the letters are not very well focused. They might be missing letters, or if you look at a straight line, it might appear a bit distorted. So distortion is another symptom. Another thing which I was talking to you about is the muscles being affected. So if the circulation of the muscle is affected, it can give rise to double vision, because both eyes are not moving in sync as a parallel unit. If one of the muscles get weakened, then it can give rise to, oh, I'm seeing two images here. So it could be due to that. Or if the nerve is affected, it could give rise to acute loss of vision. So that can also happen. So yes, it can manifest in different ways. It's just being aware that my eyesight is not good. Another thing which people often ignore is we often check one eye at a time to look out for vision, if they are both equal. When we close one eye, we'll know the other eye vision is blurry. So comparing the two eyes and making sure that they are fine is also important step, which we all should be conscious of doing, because one eye takes over and compensates for the other. And we generally don't find out that one eye is affected until accidentally we tend to close up for some reason.
Right. Okay. So is it like a nuclear fusion kind of a phenomenon wherein once it is developed, the changes are going to be irreversible, or can it be?
No, absolutely not. With good control of diabetes, there's quite a few changes are reversible. There are few changes which structural damage happens, then we have to do treatment to prevent it from progressing. But majority of, when it is a mild stage, and when it is pre-diabetic changes, when they develop very early diabetic changes and moderate changes, in good lifestyle changes, better control of diabetes, these changes can be reversed, and the prevention can certainly be prevented if good control and good active lifestyle is.
You are talking about prevention of eye problems in the diabetes. Can you please elaborate a little bit more on that? Because it might help the people who are listening here, especially the diabetic people?
We have to understand.
Is it purely about controlling the blood sugar levels only, or anything else matters here?
Control of blood sugar levels as far as diabetes. What happens in diabetes? The blood vessels get very tiny and they start leaking, and the blood vessels, the amount of oxygen carried by the blood vessels goes down. So this is the root cause of the problem. So when there is lack of oxygenation, the eye manifests in circulation being cut, and then when the oxygen levels are deprived at the back of the eye can think, I do not have enough oxygen, I'm going to produce abnormal blood vessels, and that can bleed. And when there is lack of blood supply, the eye can produce some leakage where protein deposits can happen, then that can give rise to changes in the eye. So it's basically when we control diabetes for a long period of time. It's not just one day control. It has to be maintained over a long period of time. Then all these structural damages can be limited. And, as I said, progression of diabetic changes can be prevented. If they are in the very early stages, it can be prevented. It can be regressed as well. Progression of diabetic retinopathy and the changes and everything can be prevented if a better sugar level is maintained. And better sugar level maintains can be happen because of lifestyle changes, sugar levels, modifying the eating habits, everything comes into play.
Right. Okay. Dr. PP, thanks a lot. You have been very kind enough to have explained about the problems that happens with diabetes and the prevention. I think as this topic is quite a long topic, regarding the treatment in diabetes, is it okay I borrow you in the next session or will you be able to cover today itself?
See, in a nutshell, I can say basically there are nowadays with advancement of technology have lots of treatment and there are lots of ways to capture images and find out if there are diabetic changes early. We have absolutely beautiful scans which were not available about a decade ago. We can detect these swelling. We have injections available now. I'm proud to say that the number of blind registrations have gone down significantly ever since because the diabetes can be detected early, treated early. Lasers are available so that we can arrest the abnormal blood vessels from bleeding. There are injections available which can cause regression of the abnormal blood vessels. So it's the knowledge and the awareness that if the sugar levels are not, despite controlling, if there are changes happening, then we should be aware of the symptoms, seek opinion on a prompt action where injections, lasers, and medications can be given to prevent progression and to treat the existing.
Fantastic. What we will do is we will have another session, an elaborate session purely on the treatment aspect of all these conditions, whatever you have mentioned. Friends, thanks a lot for listening, Dr. Priya's wonderful information that she passed on to us regarding diabetes in the eye. I look forward meeting her in the next few sessions wherein we can discuss about the treatment that are available for diabetic eye problems and also all other diabetic or non-diabetic related eye problems. If you have got any queries or anything that you would like to know regarding any medical problems that you have got, which has got any specific affection on the eye, please do write to us. Dr. PP will be able to clarify that. And in fact, we can produce more videos on those specific topics of whatever you want to know from us. Now, please subscribe to our channel, IWSO. And if you've got any major medical queries or anything at all, we are there to help you. All you need to do is just email us at iwantsecondopinion@gmail.com. Thanks a lot, guys. Bye-bye.